Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. Funding for Chautauqua Sunrise is provided in part by the Chautauqua County Industrial Development Agency, with offices in Jamestown, Dunkirk, and Westfield, helping businesses to prosper throughout Chautauqua County. From supporting people with disabilities to enjoy great lives to providing health care services that are available to anyone, the Resource Center has been improving our county for more than 60 years. Learn more about how the Resource Center makes a positive difference in people's lives. From the Access Chautauqua Studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Chautauqua. We are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week from 9 to 10 a.m. Send events via email or call us live. Check us out on YouTube and Facebook. And now, from the Access Chautauqua Studios, it's Chautauqua Sunrise.
Good morning, everyone. I'll get the words out. I'm Doc Hamels, and welcome to Chautauqua Sunrise. Hope you're all doing well this morning. Little brisk out there, 18 degrees where I live up on the hill in Ripley. It is going to be a beautiful day, though. The sun is shining out there, and I was thinking, boy, I need to get some sunglasses. It was really pretty. I want to say good morning, of course, to everybody that's viewing right now on Spectrum 1301, or if you're on Facebook watching us live, we're streaming around the world, so thanks for joining us. Also, good afternoon for those that are watching us streaming live over in Europe. I know Cor over in the Netherlands checks in from time to time, or a variety of other places and other folks that are checking in. So glad you could check in. It's always fun to know that internationally we're sharing information and people are, interested in what's going on here in Chautauqua County. And for those that are watching that are not from the area, we welcome you to come visit sometime as soon as it's safe and we all can feel comfortable not wearing our masks again and that we're all vaccinated, and that can't come soon enough, huh? A reminder that if you are listening Tuesdays at 1 o'clock on WRFA 107.9 Low Power to the People, you can also catch us on Spectrum 1301 throughout the week at 2 and 8. But anyways, good afternoon to all the listeners in Jamestown area and our friends over there. This is a live call-in show, only from 9 to 10. And the number, if you want to give us a call, is 716-753-5225. If you have an announcement, something you want to share, your club or organization's going on, if you have a question for my guest or myself, be happy to have you on the line. Our friend Randy, he takes all the calls and he pumps them over to us through the speaker here or whatever, or writes down your question. And people do send in questions. And then I sometimes get text questions. We're here to just share information, okay? A reminder also that although the holiday season is over and the shopping is done for the year, that I have my little heart here, is remember to shop locally, shop small. Right now, there's more stimulus money coming in and a variety of grants coming in to help support our local companies. It's really been tragic to watch so many of the mom and pop shops closing because they just couldn't keep up with the lack of business. I guess that's really what it comes down to, and the never-ending expenses that go on even though they don't have productivity or customers coming in. So let's try to maintain what we have and bring back those that maybe have closed temporarily. Mom and pop shops, we call them that, but our local businesses are really the mainstream of our community. They're ones that pay taxes, that supply services and goods to us. Without them, we'd be in serious trouble. So please, let's think about that as we're out and about and shopping. Okay, got some fun things going on today. We got the Buffalo Bills. I know not everybody's a Buffalo Bill fan, but you can for at least a few weeks. Kind of. You could, Justin, you could.
Well, you should hear my brother talk about them.
Oh.
He will say lose.
Well.
Big.
Well, anyways, the Buffalo Bills are back where they belong after 25 years. I remember back in the 90s, the excitement of the possibility of them going to the Super Bowl, which they did, of course. But it's always tough when they lose. But we're hoping they're going to go all the way today, and hopefully next week we'll be talking about the next game. So 1 o'clock today, from what I understand. So Brody and I are going to hunker down. We're going to get our snacks, and we're going to watch TV while everybody else is doing whatever. But it's always fun. I try not to get too emotionally wrapped up into it, but some people, they do. Okay. Let's see what else we got here. I really don't. Oh, I got a few announcements, so let's get to that, and then let's see what else I got written down here. Okay, just a couple things. Now, people might think, well, where do I get this information from? Throughout the week, I'm part of the media, and we get announcements from various organizations. You know, I always comment that on a busy day, sometimes we've had as many as, 13 pages of announcements, and today we've just got 2. So let's go through these and see what we have to talk about here. Okay, let's start with the first one, Jeff. Jamestown City unveils online tax bill payment service. Now, this isn't exactly like breaking news, but the reason why I like to talk about this stuff is because it's local. It's important to people's lives. Maybe some of these things can help make things better for you. If you're listening and might say, well, gee, that's a nice service I like to have, or if you're going to be out of town or whatever. So let's see what they say here. The City of Jamestown has unveiled a new way for taxpayers to pay property taxes in 2021. I'm still getting used to saying that. Property owners may go online to pay taxes in addition to paying in person at the municipal building or mailing in tax payments. So now I got 3 choices. The city has agreement with Municipay, that's the name of the company, which allows for third-party processing of credit card and e-check payments. It's sort of like PayPal, I guess. The service comes at no cost to the city. You're going to pay a little bit. That's where they make their money. Mayor Eddie Sundquist said the following: we want to give a contactless way during the pandemic for property owners to pay their bill without, having to be in contact with folks. Also, many people prefer the convenience of being able to pay online, and we wanted to expand city services to reach that population. I can think of a variety of times where I've been on the road or out of the country and something was going to come due, and so it's nice to have the option that you could pay it online. Sundquist added, I'm proud of our controller, treasurer, assessor, and IT staff for working together to prepare this new service in time for the 2021 property tax billing. City Clerk Treasurer Jennifer Williams says the following: "We're always looking for ways to improve service for customers, and this online tax bill is hopefully the first of many steps forward in that goal. The online payment option is a flat $1.50 fee for the e-check payments, or if you're using a credit card, a 2.265% convenience fee, which is pretty standard in the field. Property owners may pay online by visiting Jamestown NY, so like all one word, jamestownny.gov/pay, and clicking Make a Payment button at the top of the page. Payments may be made in person at the municipal building still, located at 200 East 3rd Street in Jamestown, and the office hours are from 9 to 4:30 p.m. Monday through Friday. Payments can still be mailed by making checks payable to City Treasurer and mailed to City Clerk /Treasurer, 200 East 3rd Street in Jamestown, New York." So anyways, that's a new service, and I thought that was kind of interesting. It's nice to know that people are looking out for all of us and finding ways for us to stay safe and healthy and trying to keep this pandemic under control. That's just one small way. Our friends at Prevention Works have a program coming up, and we talk about them all the time. Happy to do that because this is, again, another service that many of you may be interested in. So this is what it says. It says, "Join us for our incoming active parenting classes, ages 5 through 12. Now, if you remember, we did 0 to 5. Now we're doing the 5 through 12 kids. It's going to be 3 virtual 2-hour sessions via Zoom, video communications. Now, if you're not familiar with Zoom, Zoom is an application that you can put on your phone, your computer, your iPad. And when you click on this and you have the right invitation from Prevention Works, they send you an email, you click on it, but you got to download Zoom first. And then when you click on the email link, it automatically does like the Jetsons. You can look at somebody from a distance, and there they are on your phone, and you talk to them live, and you can listen and learn. So this is going to take place January 13, 20, and 27. So 3 weeks in a row from 12 to 2 p.m. And active parenting will give you the skills to achieve a fuller, more satisfying family life and help your children achieve greater happiness and success. The workshop will show you effective ways to do the following: open up lines of communication, teach responsibility, courage, and other important character traits, encourage school success in 7 steps, prevent further future problems with drugs, alcohol, and sex, use nonviolent discipline that really works, diffuse power struggles with your children, stimulate independence as your child grows older. Now you might be sitting here and thinking, "Oh, I know how to do all that stuff." Well, fine, then you don't need the class. But a lot of us, especially the first time we're going through this with our little guys and gals, we're not always sure on how to approach it. We always laugh, there isn't a manual that comes with the baby as the child grows and so forth. And sometimes we don't have a model of parenting that we're comfortable with or that we learn from. And so this gives you some ideas. And I think that a lot of parents would say and agree with me, boy, if I had known this then, maybe I wouldn't be here now. That makes sense. So you can check it out, it's free. For more information, please give Kathleen Colby a call. She's the Director of Parenting at 780-2721 or 664-3608. All right, so again, it's free. It's January 13, 20, and 27 from noon to 2. All right, so that's the end of those. Now, I just have one small little commentary, and we're going to go through a public service announcement. And I'm looking for my guest that's waiting in the wings to come in. So let me just share this with you. Being a TV host and producer has its challenges just like anything else in life. One of the things that when I started this show, Chautauqua Sunrise, I decided to have a mission. And the mission was very simple, to talk about the good stuff here in Chautauqua County. I have to tell you that it's like the devil sits at my doorstep and just teases me all the time so that I want to come out and talk about what else is going on outside those doors, down in another state or over in DC or across the ocean or whatever. My mission doesn't include that. And I want you to know that. I want you to feel that when you turn on this TV show or you're listening to this radio show, that this can be an opportunity just to take a little breather for an hour, to get away from the chaos that's ensuing out there right now. We don't try to take positions on things because we're not here to debate. We're here to share information, to educate, to entertain, to expand our consciousness in certain areas. We're not here to tear down or build up. We're here to talk about us here in Chautauqua County. So I want you to know that I'm often silent on a lot of issues that are going on there, and it's purposeful and it's part of my personal mission for the show. So if you want to hear other things, go on another TV show, but it's not going to happen here. So with that, I wish you a calm Saturday, and that we're going to continue on. We're 340 shows into this project, and I plan to do another 340 shows exactly the same way. So with that, we're going to take a little breather, and we'll be right back. Stay tuned.
It's a short ride from your neighborhood to your naturehood. To find a neighborhood park or green space near you, visit discovertheforest.org.
Okay, so we are going to be waiting for our guest to show here. She's running a little bit late, but I can kind of talk about a few things here. People often ask me, well, who do you pick and why do you pick the people that you pick? Dr. Mary Ann Spanos will be coming in here shortly, and she's been representing at the county level senior services and senior programs and so forth. And prior to my show, there was a show called The Senior Report. Many of you remember Reed Powers. Reed talked a lot about senior issues, and rightly so, and we try to do the same thing. For those that have followed Chautauqua Sunrise all these years, we have expanded the palette of colors, and we talk about a lot of other things. But today we're going to be focusing on senior issues and what the county offers through the Office for the Aging Services and Mary Ann's program. Weekly we listen to Linda Spalding when she calls in, and so happy to hear her voice all the time. And she's always talked about the senior work program and all the good work that they've been doing. So today we're going to hopefully be talking about some of those things. One of the things I do encourage you to let us know is if there is a topic that you are interested in, please drop us a line and we'll try to get someone in here to talk about that topic, and we'll expand excuse me, on that, and who knows. But today what I hope to talk about with Mary Ann are a number of things. And maybe I'll put these topics out there, and then maybe you could think about one that you want to talk to her about. But I want to talk about, obviously, the COVID pandemic and how it's affecting the lives of seniors, and what the county is services they're providing. I want to talk to her about world events, not in the way I just talked about, but people are glued to their TVs, they're glued to their iPads and their iPhones, and they're reading media. And I'm wondering how that's affecting the lives of people that are holed up right now at home. And because of COVID, we're not going anywhere, so we're getting bombarded with stuff. And maybe she has some therapeutic things for us to think about, maybe limiting our time on TV and so forth. Of course, we know that as we grow older, our energy levels and our resources dwindle a bit, and so it's easy to become isolated. And so I'm curious if she has some ideas on dealing with isolation, especially if we've lost the spouse, or if our immediate family is moved on to other geographical areas. and things of this nature. I want to talk about general health and what people should be dealing with right now. It's a bit confusing because I know when somebody will say, I don't feel well, and but I can't go to the doctor because I don't feel well because I got to get and some places, and I'm not speaking for everybody, but I can't go to the hospital because I got to get a COVID test to go to the hospital. And so it's confusing for people. So hopefully we can straighten it out a little bit. And of course, Linda Spalding has been alerting us that the senior work program has been taken over by a different organization, not taken over, but they got the grant, and so they are taking it over, but not in a negative way, but in a positive way. And we hope to find out more about that sort of thing. So if you have some ideas of what you'd like to talk about, or have a question for Marianne when she comes on, maybe we can get you on the line. So Jeff, maybe you can queue up another public service announcement, and we'll find out if Marianne is en route. So if you have something, you can just drop it in any old time and just let me know. So again, the number here is 753-5225, and don't hesitate to give us a call. If your organization is going to have an online raffle, or if you're doing something virtually, or if you're going to have a club meeting and you want the word to get out, we'll be happy to share that. Just give us a holler and let us know that. Okay. We've been watching the Buffalo Bills. We talked about that earlier. And let's see, I just got a message. Hang on. Oh, okay. Got a little message here. I just got to read it here a bit. Okay. Are these? Let me ask a question. Are these things are they still on the air? Okay. It was just a reminder that we do have some programming that we did with the Chautauqua Strong, and that's on YouTube. That there are different programs on the exercise, Tai Chi, cooking, and those sorts of things, and so you can find those. And you just go to YouTube and look up Chautauqua Strong and Healthy, and you'll see those. And it's been a busy year. We've done a lot of programming here, and there's some discussion that we might be doing another series about fitness and so forth, so we'll see about that. Buffalo Bills, I was mentioning, has been a lot of fun to watch them. What are you laughing about? You evil one. Randy's over there. Why aren't you? Okay. So we've been enjoying that, and I know they're going to let 6,400 people in today or something like that. So I know they're excited. Okay, I understand my guest has arrived. All right, let's do that, Jeff. We're going to go with the public service announcement, and then we'll be all set to go. So roll with this, and we'll be right back. Hi there.
You're going to need me. You're going to need us. All of us. You're going to need our technical skills, our math, our engineering skills. You're going to need our help with your water, your air, your food. You're going to need our organizational skills, our problem-solving skills. You're going to need our determination, our honesty, our compassion. You're going to need the next generation of leaders to face the challenges the future will bring. And we promise we'll be there when you need us.
Okay, we're back. Live TV is always lots of fun, and I have some guests that like to challenge my ability to keep talking, so that's okay, because I can. Just ask my family. Dr. Marianne Spanos, welcome back to the show. It's been a little while.
Yes, thank you so much for having me.
I don't remember it was the last time we've been here, but it's been a while.
Yeah.
I was thinking about how Ray Powers had you here like every third week.
He did.
But his mission was a little different, in constantly talking about senior issues. But before you arrived, I let folks know that the topics I'm going to ask you about. So I'm going to tell you what they are, so be prepared. want to talk about, obviously, COVID and seniors. World events, not that we're going to talk about the world events, but the impact that we're all watching TV, our iPhones, our iPads, and how that can really make us upset or joyful, depends on where you are. Isolation, with everything else, if we took everything else away, there's still isolation issues for seniors, right?
Yes. It's a
Our
big
general
issue.
health, because of the pandemic, because of isolation, because of stress, all those things. And of course, Linda has been informing us that the senior work program, employment program, has changed hands and how we're going to transition. So first, before we do all that, Happy New Year.
Happy New Year.
Thanks for joining us today. It's the funniest thing. Last night, we were sitting at dinner over in Northeast Pennsylvania, Johnny B's, and my sister-in-law said to me, "So who's your guest?" I said, she gave me a different name. She kind of took Linda's name and your name and put them together. I said, no. I said, it's Marianne Spanos going to be. And she goes, oh, that's right. And she said she had seen it in the newspaper. And 2 seconds later, you dinged me because I had texted you. And I said, whoa, there's Marianne right now. So glad I reminded you to be here.
Yeah.
So anyways, so I know that you've been moving offices and grants change over and stuff. So let's start wherever you want to start with those topics.
Well, let's talk about the offices first, because there was some misrepresentation in the papers about that. We have always had 3 offices, and we will continue to have 3 offices, one in Jamestown, one in Mayville, and one in Dunkirk. And that's for the convenience of the seniors, so that they have easy access to us. Many of them don't want to drive all across the county to get to our offices. And, we continue to know that we need an office. I mean, there's not everybody who's going to access us by telephone or by Zoom or some electronic means. So they need to have a physical presence there and be able to sit down with us, even though we're not really doing that right now. So we still will have that. What we've done slowly, when I came on board, we had 4 offices then. We had one in Sinclairville.
I didn't know that.
Yeah, we had one in Dunkirk, one in Jamestown, and one in Mayville. The Sinclairville office, we had a full-time person there, and it really wasn't seeing the traffic that we needed, and so we did eliminate that office a few years after I came on board. Just didn't make sense fiscally to have that office
Tough decisions,
there.
but you got to weigh it. Yeah, you got to weigh that out, though.
But I don't see us, eliminating any more presence.
So was there talk that they thought you were? Is that I didn't hear
in
that.
the paper? It sounded like we were moving everybody from Mayville to Jamestown.
Okay.
And when I came on board, there was one person, actually 1 or 2 people in Jamestown, 1 person in Dunkirk, and the bulk of our people were in Mayville, where it's not the seat of the population.
Right.
And so slowly, because it made more sense given where our population is, we've been increasing the number of people in Dunkirk. We now have 3 to 4 people in Dunkirk. We have about 8 in Jamestown.
Kind of sounds reasonable.
Yeah.
You bring
And so-
services to people rather than
Right.
bring people to services.
And at the same time, there's been a lack of space in Mayville for other departments who need to expand there. So we're moving a few more people, some nutrition staff. I'll kind of be between Jamestown and Mayville more, and 1 New York Connects worker to Jamestown, to the new location.
Well, and really with today's technology, you don't have to be physically in the same space to communicate. I mean, through this pandemic, we've all learned Zooming, right?
Right.
Zooming more than, I'm retired and I Zoom more than I care to.
Yeah.
So we can stay connected and I think change is always weird for people. That goes without saying, but maybe that's what we're hearing.
Well, it's a wonderful opportunity for us to go into the Chautauqua Center in Jamestown. They have built that building so that there are many community rooms where we can hold senior gatherings, whether it's
What year would that be?
in
2022, 23,
hopefully by the end of 2021.
Please hurry.
Yeah. We'll see how, the vaccine rolls a little faster, hopefully.
But the potential is there for sure.
I'm actually more hopeful that because we're a rural area, it may not take as long for us. It's still going to be months, but please be patient. But I think they're going to have a harder time in bigger cities getting people, just because there's such a massive population there.
Right. So, so then you're moving to the Chautauqua Center at both ends of the county?
There's been no talk at this point of moving the Dunkirk office. We're in the Dunkirk Senior Center.
Okay, so just in Jamestown
So
area.
just in Jamestown at this point.
And the address there is?
It's Institute Street. Do I know the exact address? Institute's like one block long.
Was that Justin?
107, thank you. It's only a couple blocks long, so you can't miss that big, beautiful building.
And we've had folks from Chautauqua Center here over the months now, and they're doing great work there.
They are, and it makes sense for us. Our mission, although we serve all the seniors, and there are many of our programs that serve every senior out there, we do have a focus on serving those who are low income and minority. And being in the middle of the city where some of these people still walk to get where they need to go, that makes sense for us to be there. We're going to be right between St. Susan's and the Salvation Army.
Okay.
And during this pandemic, we have worked closer than ever with those organizations about feeding people.
Oh boy.
Yeah. Trying to help them because they had been really overrun in the beginning with people coming to them for food. And we said, if they're older, send them to us. We have the resources to serve them.
Earlier in the show, I was talking about shopping locally and that how this pandemic has affected the local economy, and people are out of work.
Yeah.
They're stretched for food and having to make decisions between this and this and this. So yeah. That's amazing.
But we've changed a lot of our nutrition services during the pandemic to kind of meet that need.
In what way?
So before the pandemic ever hit, we started talking to the Department of Health because they are required, if they quarantine somebody, if you're in quarantine by their orders and have a need for food, they need to help provide that. And they don't have kitchens, so they came to us early on in the pandemic and said, can you help with food if people need food? And so we started working with our local kitchens at SUNY Fredonia and WCA Hospital to put together a 7-day meal pack. And that has 8 frozen meals and a box of shelf-stable breakfast and lunch items. And so people who are in need of food and have to stay home in quarantine can get food through us. And the Sheriff's Department actually stepped up to help deliver that so that we wouldn't expose our Meals on Wheels people to, virus.
This is the first time I'm hearing this.
Really?
Why don't I know this? So what you're saying is you're in the food business and that you can provide a week's worth of food to seniors that are quarantined.
Right. Well, so we are doing that right now for the people who are quarantined by the Department of Health.
So it could be anybody.
Yes, it could be anybody.
Wow.
But because we've started that, we found some seniors who were challenged early on and were afraid to go to the grocery store. And so sometimes we've used that, what we've stockpiled as food to drop them a week's worth of food.
That's wonderful.
We also noticed that, many people had money to buy food. They just were afraid to go to the grocery store. So early on, we also utilized some of our staff to help with shopping assistance. Just the technology part. So you could call, our New York Connects helpline and, if that was the issue, that you didn't know how to use Instacart, which many of the food places used, or Walmart has their own thing, but we would help you with that.
So this is like if you wanted to call a place and say, I need these groceries, and they bag it for you, and then somebody goes picks it up?
Right, so most of that's online though.
Right.
So if you're not familiar with that, we got one of our millennials to help with that part of it. You pay with your own money,
Right.
or your SNAP benefit. We did figure out with our Department of Social Services how we could get a consent to help people utilize their SNAP benefits, because
Wow.
SNAP benefits were increased tremendously during this time, but people were afraid to go to the store. So, we don't have unending money to provide food, so we're trying to get people to use their own resources, and most of the
Absolutely.
time they want to, they want to, and they want the particular food rather than the Meals on Wheels,
I came up with these questions for you, and this was the framework that I used. My parents are both passed now, but I could try to imagine how my mother and my father would have dealt with what's going on right now with the pandemic and everything else. My mother would be just totally out of her mind. When you say worrywart, her picture is in the dictionary. She
Right.
worried about everything. Even as a full-grown adult, she would worry. If you had a straw, be careful, don't swallow the straw. I'm like, Ma, all these years, somehow I managed not to swallow a straw. But she was just always worried about everything. And I'm thinking to myself, well, if there was one mom that worried like that, there's got to be hundreds right now are just fretting about what's going on. Are you finding people really upset and worried?
We found some, it's hard to find people who want help. So we did a couple other things,
Yeah.
During this time, we went through everybody who was on our wait list and offered them one of those emergency response buttons.
Beautiful.
And put those in for a good 6 months, and that has helped people. And you can, if you have one of the emergency response buttons from our office, you can press that button anytime. It doesn't have to be an emergency, and talk to somebody.
Nice.
There's a social worker on the other end of that line, and just if you want a friendly voice. We actually had some people who were really upset during this pandemic, and we worked with our emergency response provider to do outgoing calls to those people that we identified who were, because our staff love to talk to them, but it gets hard when they're calling you 20 times a day. So we got another person to kind of call out and help.
Kind of do a daily wellness check. How you doing, Gladys?
Yeah, however often they wanted.
Let's talk about that button. Okay, so I know it comes in different styles and things like that, and costs. So let's talk about that, because I think that's important.
So, everybody calls it Lifeline, but Lifeline is a registered trademark. Ours is through a company called CST, which just was bought out by Best Buy. So Best Buy Health is now our PERS provider.
Okay.
And they have a unique model where they do have a social worker who answers the phone, and they tell you to press that button for anything. It doesn't have to be an emergency.
You wear this around your neck, on your wrist, your belt. Where do you wear this?
You can wear it wherever you want, but most of them are around your neck or on your wrist.
And do you have to charge this thing?
The standard button and the cellular button you do not, because it has a battery and it probably has to be changed every couple of years. But the other, it has a big unit that you actually speak through.
Oh, okay.
The mobile unit,
Right.
which we use for dementia clients as well as people that are more active. Like my mom has a mobile unit because she likes to go walking for 2 miles on the river in Buffalo, outside of Buffalo. And, we always worry about her falling and, who's going to find her. And it also has a GPS so that you can kind of track the person if they wandered off into the woods. So we use that for people with dementia and more active people.
Now, there's some cost involved. There's got to be some cost, right?
Well, there are. If you want to privately pay, the GPS, I think, is about $40 a month.
$40 a month, that's it?
That's it. No equipment to buy, no.
Peace of mind.
Yes,
I mean, you can sweat that much in a day just
Right.
worrying.
Right.
All right.
And we do have some grant funds for people with dementia who will put those in on a, cost sharing basis.
Right.
The cellular unit, I want to say, is about 30. And then the other unit, the basic unit, is about 25.
I talked my dad into having one, and he grumbled because he forget to charge it. But he used it a couple of times, and they checked in with him, and he was fine. But we all had the knowingness that me living in Chautauqua County, him living in Erie County, sounds like your mom. That somebody can get to them really quick.
Exactly. And I think a lot of seniors are afraid that if I press the button, it's going to call 911 immediately. That is not what happens. Because, probably 90% of the pushes are not emergencies. So it's somebody to talk to. Are you okay? If you don't respond, then if it was your dad, they probably have you set up in their system
That's
as the
right.
person to call. Say, Doc, your dad just
We
pressed the
get a
button.
text message or a phone call. Yep.
Is
something's
he
going on.
okay?
Yeah.
Or a neighbor next door to go check on that person as a last resort. If they couldn't get a hold of the person or the backup, they would send a
EMS,
sheriff to do. Well, usually a sheriff to do a well check.
Oh, okay.
And then see what's going on.
Okay.
So
Let's change directions a little bit
Sure.
because we talked about vaccines. So, what is the current message for seniors? I mean, they're like in group 1C or something or other. I'm making this up. I don't know.
yeah.
But they're supposed to be sort of towards the high end of priorities. Is that still true?
My understanding is, but we're still in phase 1A,
Okay.
which is basically healthcare workers
Frontline EMS workers.
Yeah, and so is pretty much 1B. So I just wrote an article on this yesterday, and it should be appearing in the paper. But your best information is to look at the New York State Department of Health website on the vaccines and who's the priority. Now, tell you a couple things that we've been doing to try to help the health department. So if you call the health department and say, when am I getting my vaccine? They don't know. They don't know, so it's not helpful to call them. But you could call our office. Our New York Connects helpline will tell you what phase we're in. And we hope in the next week or so that we're going to be able to capture names of people who want to be vaccinated. We are already, in the last month, I've been reaching out to all the housing units. So if you live in a senior housing, we've been asking them what their census is, how many people are living there and over 65, and so that gathering that information, so as the health department starts to move to that, they know where the bulk of the people are.
So they can mobilize pretty quickly.
So, the state knows who's in the hospital, they know who's in the nursing home, and they know who's in assisted living. And that's what they're starting with right now. In fact, our adult daycare also got, all the staff at the adult daycare got vaccinated this week.
Good.
Because they're part of the Office with People of Disabilities, and that was a priority.
Okay.
So they know who are in group homes, So all of those are going to be vaccinated first. It was the workers, and now it's the people living in those what they call congregate settings, nursing homes and assisted livings and group homes is going to be next. So the people that we're trying to capture, and I'm trying to capture it to assist the Department of Health as they set up vaccination clinics, is who's living in their own home who wants to be vaccinated. So in the next week or so, I've been working with the State Office for the Aging, how we can capture that in our system very easily. It'll be simple questions. We need your name, address, and date of birth.
Here, let me give you my business card right now. I'm ready.
And do you want the vaccine?
Yes, bring it.
We also put a question in there because we're sure down the line there's going to be people who got the first dose and are looking for a second dose. So if you've already had a first dose, we might ask you what was the date that you got that.
Right, because you got to wait a certain amount of time. Right?
And then we could put a comment in if they are looking for the second dose. And we can pull that into a report that we could easily sort for the Department of Health and say, hey, these are all the people that need a second dose, or these, in this town, this is how many people you've got.
Wow.
And we hope that we could be part of, reaching out to those people as clinics are set up to say, the clinic is coming, it's going to be on this date, or whatever we need to do to assist. These early vaccinations, some people do have to go online and register. They're not doing that uniformly. I found out from the adult daycare, they were just told, go down to WCA and you'll get your shot. So we know that that's going to be hard for people with, living in the community, older adults who maybe aren't as familiar with registering online.
As this unfolds, I would be proud to be announcing that here. And we can get it on our community bulletin board that scrolls throughout the week. So
Yeah.
please utilize us as well.
We will
Let's
do
team
that.
up on that.
Yeah.
Okay. So for the moment, somebody like myself that over a certain age, we just basically got to wait till they announce when the clinics are going to be available.
Exactly. If you're really nervous next week, you want to call our New York Connects helpline. But right now, people are flooding the Department of Health with, questions about that through email and phone calls, and realize they just can't call you back. They're in the midst of, they still, have to work with all the people who have COVID and quarantining them and contact tracing them. And they're trying to assist they didn't even get the first doses of vaccine. The first doses of vaccine went to the hospitals. So they're trying to work with the hospitals to help get everybody in that first group vaccinated.
Okay, for those who are listening on the air right now over on WRFA, the number for New York Connects is 716-753-4582. One more time, 716-753-4582. Are there hours that's open? Is that 24 hours a day, or what's the hours?
Our staff is there from 8:30 to 4:30, but leave a message. They usually call you back within 24 hours. We're not an emergency line, and these aren't emergency issues.
Right.
But we'll get back to you usually within 24 hours.
Okay, great. Let's talk about general health. I mean, it's tough enough being in the winter. It's tough enough being stressed. It's tough enough to be isolated. I mean, we've done some programming with you guys about Tai Chi and so forth. What was the reaction? Did we get any feedback from anybody? Did they watch the programs? And should they be watching the programs?
Yeah, we've gotten some good feedback on that. I couldn't tell you how many. I just
Right, no, I'm
haven't
just
been
curious.
paying attention to that. But we've done that. We have animatronic pets. Did you know about our animatronic
Oh,
pets?
do tell. That sounds so. This is right up our alley here, right, guys? Technology. What?
Animatronic pets. There's a company called Joy for All.
Okay.
And they produce these pets, cats and dogs, that act a lot like real pets, but they don't need to be taken outside.
Oh my! Tell them that's 6:45 this
they
morning.
need
Come on,
petting
Brody.
and and they have been very helpful for some seniors. My mother thinks they're stupid.
Oh.
But there's a lot of people who, when the adult daycare was closed, we hooked them up with animatronic pets, and they just loved it. And it's something, just to be soothing for them. If the cat sits on your lap and purrs, as you rub it, it rolls over and meows if you don't pay attention to it. Same thing with the little dog, and they were developed for people not with, people said, oh, they're for people with dementia, but they're really not. They're for anybody, but they're not for everybody.
Well, we all have things, things that we put in our hands, things that we fiddle around with. I mean,
Exactly.
like right now, just playing with my pen here. And we all look for that something as distraction while we're watching TV. So I could easily see
And
something like
it's
that.
so soothing for some people to have that presence, that's making a noise. I always put the TV on when I'm alone at home. It bothers me that there's no noise. And so I usually put the TV on. So I could see, something like that being comforting to me. But it's, as I said, not for everybody.
Next time you're on, you got to bring one of these.
I will. I should have thought of it this morning.
Doggone it.
I just got the second shipment of about 30 of them. We gave 30 out early in the pandemic, and this was the brainchild of the state office. They had started a project before the pandemic with a couple counties to see how it would go over, and they really saw, reductions in blood pressure, and just like a regular pet, people less lonely, less, anxious.
Anytime you want to bring one in, just let me know. We'll have you do a little piece here or whatever.
Okay.
Just let me know. Brody, if you're listening, you can be replaced.
Well, you could even stop over this week and borrow one or two and show them on the show next week if you'd like.
Oh my gosh. How big are they? Oh, they're good
Yeah,
size.
they're a
All
nice
right.
size, like a cat size. The dog is like a puppy. And
my gosh,
it's a little
too funny.
golden retriever. The cats come in different colors. There's a black and white, and there's a tabby. And they're very cute.
Oh my gosh.
They're very cute.
That's two new things. I didn't know about the food and I didn't know about the pets. That's very cool.
So as I said, we're getting ready to give out the next round of them that we just got.
Okay.
And,
So how does someone get one of these if they're interested?
right now, we're trying to identify clients, but if the state has developed a discount if people wanted to buy them. So if you contact my office, I can help you with getting that discount. I think without the discount, they're about $120. And
You don't have to feed them. You don't have to take them
Yeah,
out. You don't have to go
yeah.
out up in the morning. You don't have to go out late at night. I'm all in for this one. No shots. That's right. And my little guy, he loves to roughhouse. He likes to bite me, not bite in a bad way. Like he just grabs me, and he's like,
Yeah.
he's a crazy dog.
how big is he?
He's about 35 pounds. Yeah, he's a cruiser. He's a little Tibetan Terrier. So
But
he's
Joy for All is the company. If
Joy
you
for
want to
All.
look on their website, and it's really been a help.
My wife has wanted a cat, and we've talked about it. Maybe this could be it. This could be the perfect birthday present next year. I bought you a cat finally, and I don't have to clean it. Oh, that's too funny. Let's talk a little bit about the senior employment program, because I know Lynn said that the Goodwill, I think it was.
Goodwill of Western New York.
So
yeah.
how I wasn't aware that it was a grant program to begin with, but a lot of people may not know this, but many services are grant funded, and sometimes you are not the winner of that grant, or somebody else comes in with a better idea or whatever. So
Well, for this one, we have been the grantee long before I came on board, but very few offices for the aging across New York State are doing the senior employment program anymore. It made a lot of sense for us. When I first came on board, we had, I want to say, between 60 and 70 people that we were utilizing in the program. It has dwindled down. I think we have money for about 30, but this last year, less than 25 people
well, and
were.
with the pandemic and everything else going on, holy mackerel. It's tough to
But
run
even
some-
before that, it's, Congress has not had a lot of, I don't know what to say. They have not, they
Your
keep
focus
cutting
hasn't
it.
been there?
Yeah, they think it's a redundant program. Unfortunately, I think it's an excellent program, but sometimes that's hard to get through to Congress. But it made a lot of sense for Office for the Aging to be the grantee, because in the beginning, we utilized, I would say, about 8 to 10 people in our offices alone, as well as at the Sheriff's Department and the Department of Health and the Department of Records and at Meals on Wheels and at the adult daycare.
Wow.
And so there were a lot of people that we were serving and utilizing, and they get paid by the Department of Labor, minimum wage. So it was a lot of capacity for the amount of local share that we were putting in, which is about $30,000. In the last year, we have less than a handful of people that we're using in county government. And not to say that isn't a good program, but when you're trying to make decisions about where you're spending the local money,
Right.
and the county is under, a lot of fiscal. And, Linda had been telling me over the last few years that she was thinking about retirement. So I don't have a lot of backup for that program. And so if she decided to retire, there was nobody who could
Things
take it
kind
over.
of lined up that way.
Yeah.
That's too bad, because we were having fun. We were always trying to think about different positions and, brainstorming.
Well, we're
together.
still going to have that. We're still having those slots here. It's just not going to be run by us.
Oh, okay.
So Goodwill of Western New York is just taking over the management of the program. They will take over any local money that needs to be done, but we will still host those people at the Office for the Aging.
Gotcha.
Anybody who currently has a position in Chautauqua County isn't going to lose it. We'll still have whatever number of slots that they deem. Those slots aren't going away unless the feds cut it more.
Right.
But there are designated slots for Chautauqua County. We were actually doing Chautauqua and Cattaraugus County. So now we will help them with all the Chautauqua County slots, helping them develop host agencies. I've told them if you need space in our offices to meet with people, certainly we will assist as much as we can, because we love the program and we want it to continue. We just couldn't see it being in county government anymore.
So down the road, if they're interested in coming on the show here, and let's get together, maybe you and them, or like a little liaison going on, so that we can do a little handoff there. But happy to host that conversation.
Great.
Get down to a couple minutes here. I know that you have lots of things you want to talk about. Anything else you want to emphasize right now?
Oh.
Not a problem. I just
Well, right now, we're dealing with the health insurance counseling program too. If you're having trouble with your insurance, your Medicare that you just changed during open enrollment, we are available to help you with any problems that you're incurring. We did have we have a new partnership with many brokers in the area who we've trained.
Oh, good.
We're not directing people to a particular person, but if we couldn't accommodate you for health insurance counseling, we gave you a list of people in the area who have been trained by us and can assist you, as well as the 1-800 Medicare.
Good. And I've heard always rave reviews about that service. People said they've saved us so much money. They were so helpful. I had too much coverage, or I had the wrong coverage, so good service.
Yeah, and the brokers really needed the training. They don't really get any training when they sign up to be a Medicare Advantage broker. So the techniques that we use were very helpful to them, and I think you're going to get a good service whether you get it directly through us or through these partners.
We're down to about a half a minute. You doing tax prep this year?
We've never done tax prep.
Who did? Somebody did.
No,
not you
there
guys.
is, yes, there is the, what do they call them, the VITA volunteers.
Oh,
and
okay.
we do refer people to them, and
That's what I guess.
so you can still call New York Connects and we'll tell you who they are, but RSVP, I think, is the point on tax prep.
Okay, one more time. How about giving the hotline for New York Connects?
So if you have any questions or are in distress and need help, or know a senior who's in distress, call us at the New York Connects helpline. It's 753-4582.
Folks, you've been watching Chautauqua Sunrise. I'm Doc Hamels. My guest today has been Dr. Mary Ann Spanos, Executive Director of the Office for Aging Services.
Right.
Got that, huh? And we're going to do it all again right here Saturday morning on Channel 1301 on Spectrum. Glad you could join us. And remember, the most important thing to do today is root for the Bills. Go Buffalo! No
they
comment
playing
back there.
today?
Yes, 1 o'clock.
My husband probably knows that.